So people, in the last video we started off with protease inhibitors, antiretroviral drugs in that protease inhibitors. Here, correct? So we have started off with the basic information on protease inhibitors. The examples which we need to know are RITONAVIR, Indinavir, Nelfinavir, very important. Then apart from these three, you can remember Atazanavir, okay? So basically these are going to inhibit the protease enzyme, etc. So the viral polyprotein cannot break into smaller functional structural enzymatic components. So whatever is formed now, they are immature and non-infectious viral particles. So this is going to be a antiretroviral drug. There can be cross resistance within the group and it is usually combined with other RTIs, okay? And they don't need any cellular activation like zidovudine, etc. So how exactly these work? They bind to the active site of the protease molecule, correct? They bind to the active site of protease molecule, however they inhibit it, okay? It is used as a reserve drug, though it is more effective than zidovudine. Moving on. We saw the pharmacokinetics, very standard pharmacokinetics, orally taken and metabolized by liver, and the metabolites are removed in urine. Same standard story. Then coming to the adverse effects of protease inhibitors. Wake up guys, the actual video starts from here. We're looking at the adverse effects of protease inhibitors. So the adverse effects of protease inhibitors, very simply you can write nausea, vomiting, diarrhea, headache. Standard whatever you write for other things. Nausea, vomiting, diarrhea, headache. Nausea, vomiting, standard that we will write. Diarrhea, headache, okay? But mainly you have to remember certain things, okay? Mainly you have to remember about renal calculi. Because this Indinavir, etc., no, they will crystallize in urine and they will cause renal calculi, nephrolithiasis, right? Then there can be lipodystrophy. So they will have impairment in the fat metabolism. So they'll have to eat less lipids. Insulin resistance, which can lead to diabetes. They can get resistant to insulin. So you try treating them for HIV and the person might land up with diabetes. Skeletal muscle wasting, limb, facial tingling, numbness. Okay, so remember, now you're giving a guy HIV treatment. Then he will come back after some days and says, I don't know why all my muscles feel very wasted and my limbs and my face, everything is like numb, they are tingling, okay? Then he will tell that he's having some issues with the digestion, etc., lipodystrophy. Then he suddenly starts showing hyperglycemia. This guy is going into diabetes because of HIV treatment. And then he might even land up with kidney stones because of the treatment. Oopsie. So we are done with the adverse effects of protease inhibitors. Protease inhibitors, antiretroviral drugs, okay? Moving on guys, let us look at, so we are done with this slide and we are done with this slide. Now let's move on to the individual drugs. RITONAVIR, RTV, RITONAVIR. Actually, the main thing you should know about RITONAVIR, first thing you already know, it is an antiretroviral drug. It's a protease inhibitor. This much we already know. But do you know that it is an enzyme inhibitor? As it inhibits other enzymes, so the drug concentration of the other drugs, the concentration of the other drugs become more. So this is always used in low dose with other drugs so that it will increase the effect of the other drugs. So it is usually given 100 milligram BD, 100 milligram twice daily along with other drugs it is given. This is called as boosted PI regimen. So you should know this term, boosted PI regimen, okay? So look at this one here. So they are combining RITONAVIR with Atazanavir, okay? So this is called as boosted PI regimen because this RITONAVIR is going to inhibit the enzyme which metabolizes the other drug. So the other drug will not get metabolized and the concentration of the other drug will increase. So RITONAVIR is always given in this boosted PI regimen to increase the drug level of the other drug. So it is given in a very low dose, that you should know. It is low dose ritonavir is used in combination with other PIs, example atazanavir, and also all others you can write. Now what you should also know is ritonavir it is not actually given with nelfinavir because it cannot make the dose of nelfinavir more, okay? So did you understand which enzyme it is inhibiting? It is inhibiting cytochrome P453A4. 3A4 guys, this is important. 3A4, if you can remember, good. 3A4. So CYP 3A4. This one, they can either write it as this or they can say cytochrome P453A4. Okay. Ritonavir you have registered in your mind? Ritonavir, come on, let us take a recall. Yeah, baby, tell me what is ritonavir. Ritonavir is a PI. It is a ARV and okay, so it is an antiretroviral drug. It's a protease inhibitor. It is actually used in low dose with other PIs because there is something called as a boosted PI regimen, because this ritonavir has the capacity to inhibit enzyme CYP3A4, that is cytochrome P453A4. So it increases the concentration of other drugs. Hence, a low-dose ritonavir is given with other PIs, example, atazanavir, so that the concentration of the other drugs can become more. Also remember, it is not given with nelfinavir because it cannot increase the concentration of nelfinavir. Very good. So, 100 mg is what it is given in. Look at this, 100 mg, okay. Let's see if there's any much information on this one also. I can't clearly see here what the dose is. Anyways, so 100 mg twice daily. Okay guys, let's move on now. Okay, I think we have studied enough in this video. Next video we will look at indinavir and nelfinavir. Okay, we will finish it soon, don't worry. Okay. Come back for the next video. We will finish off protease inhibitors. Okay. Bye bye.